Good evening. We talked about once patient diagnosed of cancer. Number one, they do not need to panic until they talk to their cancer specialist. They need to explore options of their treatments once they know what stage they have and what kind of cancer. Then options presented to them with each discipline, the surgical option presented by a surgeon, the radiation option presented by a radiation oncologist, and the chemotherapy option presented to them by medical oncologist. Once patients decide what type of treatment suit them the most, then they need to sit and understand closely what are the potential benefits and what are the potential side effects. Once patients understand what are the potential side effects, they need to be prepared and do preventive measures to alleviate or minimize these side effects. For example, skin. If the patient treatment will cause skin irritation, then they need to understand they do not need to stay in the sun. They do not need to rub on the skin or wash it with hot water and so on. If the treatment in the pelvic and the rectum in the field of treatment, they need to avoid spicy food. If they could have diarrhea, they need to avoid eating bulky food and follow diet instructions as given by their physician. Once patient complete their treatment, and in case of radiation treatment, they must not to interrupt such treatment, because interruption, especially during the course of treatment, that lead to decrease the chance of their cure, because the tumor will grow and the tumor will be aggressive and it will be difficult to control it. That's true in certain cancers and is not true for certain cancers. So if you want to interrupt your treatment for whatever reason, you need to sit with your cancer specialist, in this case your radiation doctor, and he will explain to you if you need to interrupt it. For example, you are out of town, you need to be there or do something, then he or she will adjust your treatment course to either increase the dose for certain treatments or give you twice a day just to modulate the course of treatment. Then you already received equivalent dose, and that should not compromise the chance of your cure. Very good. So once you complete your treatment, that is not the end of cancer treatment. Once you finish your treatment, you need to be followed up closely. For example, patients with breast cancer, they undergo lumpectomy or removal of the cancer from the breast. Then they complete chemo radiation treatment if the chemo is necessary, or radiation treatment only, and after that they are followed up. Once you complete your treatment, you need to be followed closely to make sure this cancer do not come back, because if the cancer come back, which occasionally happen, it is true the chance is very small for the cancer come back after treatment, but certain percentage of patients the cancer come back. If the cancer come back and we able to detect it early, your chance of cure is still excellent and there is no compromise of your cure. However, you need to follow special protocol for your follow-up. Patients who complete breast cancer treatment, after radiation treatment, they need to examine their breast monthly. They need to undergo mammogram yearly. Patient need to examine her breast monthly. She need to examine both breasts for any lumps or bumps. She need to see her family doctor, her surgical oncologist, the surgeon operated on her breast, her radiation oncologist, the doctor gave her radiation treatment, the chemotherapy doctor, the medical oncologist, if she got chemotherapy, she need to see them. And what I tell my patients, if you space it so you don't have to see all of them in the same week, you get the most benefit and you will visit them less. So if you see each discipline or each specialist once a year, if you have 4 specialists, that means you are seeing once every 3 months. And that's what I do with my patients. I see them once a year, trusting they already see other specialists at different timing, so they are seen every 3 months. So patients with breast cancer, they need to be examined by physician every 3 months. They need to be examined. Patient do self-breast examination, both breasts of course, every month, and they need to go yearly mammography. In the first year, they visit every 3 months in case of breast, and the second year every 4 months, after that every 6 months. And breast cancer need to be followed for a very long time. So if patient, say for the sake of argument, there is a question tumor can come back. For example, patient with prostate cancer, we treated with radiation. The PSA, which is a blood test, after treatment, it was before the treatment 10, for example. After the treatment, it came back gradually to under 1. Then 2-3 months, the blood test shoot up to 20 or 30. I have patients like that. PSA was under 10, slightly under 10. After the treatment, it went under 1. Then a couple of months later, it came back up to 20. So from 1 to 20, patient panics. Then I sat with the patient and I explained to him, no way the cancer will jump from 1 to 20 in 1 to 2 months. That has to do with infection. Infection could cause that. So the patient, we gave him antibiotics, and his PSA went down to under 1. So what I'm saying here, that you want to make sure that cancer come back, and you wanted to make sure it is cancer, not infection. Infection to the prostate lead to increase in PSA, and we need to repeat the PSA after treating the infection, and you usually see the PSA go down to under 1, and by time to close to 0. So follow-up is so important. Number 1, if it is cancer, we treat it, so cure is not compromised. And if it is not cancer, we need also to treat. If it is infection, we need to treat the infection and follow up patients to make sure this cancer do not come back, and if it come back, we are on top of it and treated properly. So this patients follow-up is so important, and need to be in compliance with follow-up, and follow up that and be close with your physicians.